Okay, now I'm sure you all have questions. I'm going to start by asking one myself, which arises to me out of particularly Richard and Olivia's presentations, but also Rob's to a certain extent. And that has to do with the notion of individual choice versus regulation. Richard suggested that we're a bit stupid and a bit incapable of making sensible decisions, which suggests we need higher levels of regulation in order to get us to act in sensible ways. And Olivia raised the prospect of all these potentially quite extraordinary mind-enhancing cosmetic pharmacology, all these drugs that can help us sleep less, remember more, be happier, and so on. And Rob pointed out the extent to which we do need to take control of our lives and allocate time sensibly and so on. So do we need this? Does this need to be something which is regulated for us, or is it something that we need to manage ourselves? And I might start with you, Richard. Len might come in and bring you into the microphone a touch. Yeah.
Of course, the interesting thing about regulation is we have to be smart enough to ask for it. So it's one thing to say that we as individuals might have our foibles, we do, but if we're going to regulate ourselves collectively, we have to vote for people who want to do that. Look, I mean, it was fascinating hearing. God, it's news to me that I could improve my memory and everything else, and I was sitting there thinking, would I want to? And I could only reflect on. I had to turn it around 180 degrees and think, not do I want to take those drugs, but why are we inventing them? And I'd sort of thought, wow, isn't it interesting that in the 60s people were working on drugs to help people get stoned and relax, and now we're working on drugs where kids are like, psst, want to get ahead and succeed? So, I guess I feel wonderfully uncomfortable hearing about these alternatives, these possibilities, these options. And I guess the obvious thing to think about is, should we have them or shouldn't we? But as I said, the only way I could get my brain around it was to go back one level of abstraction and think, why the hell is someone working on a pill so I can stay up all night? I love my sleep.
Olivia, you didn't say we should have these drugs or we shouldn't have them, but what you said was we need to discuss this, and implicit in that is we need to devise, I guess, some kind of regulatory regime in which, if these drugs are going to exist, we have a mechanism for dealing with them.
Yeah, I'm not a policy maker, so I don't want to. I don't really know if there is a right answer. In fact, that's why I find it so interesting. But there are massive implications, I think, if we don't regulate, and I think there are massive implications if we do. And there are philosophers and scientists that are sort of thinking about these things, and really one of the biggest issues that's coming up is this, what they term distributive justice, and that. I don't know if you're half joking about, why they're inventing these things, but the reality is people are inventing them for other reasons, like it's medical or whatever, and so these things are going to be around, and then it really is important that if these things are available, that we sort of make them available in a fair way. But at the same time, there are huge risks of just sort of. It's hard. I think what is really most important is that people sit down and actually work things through to the sort of end conclusion, to imagine what the world would be like if we did this or that, and really try and balance up what would be best.
Rob Moody, where do you come down on the regulation argument? Because, for example, if we, have an impost on bringing your car into the city, which a lot of people would probably support as a way of reducing traffic congestion, encouraging public transport use, that's a form of regulation. It's a form of incentive to privilege one behaviour over another.
I mean, regulation has a place to play in society. I think it's the rules. I mean, the rules by which we survive as a group, as a collective. And there is good, sensible regulations, and there's silly regulations. and there are places where we probably don't regulate where we should. We've had this real debate with the Preventative Health Task Force, which is looking at tobacco, obesity and alcohol, and what is the role of legislation and regulation, and this tension between individual responsibility and societal responsibility.
The obvious example being junk food advertising during kids' television ads, for example.
It's trying to get that balance right, because we don't live in a world where people are completely free to have agency to make all the decisions because they're so bombarded by, the environment tells them what to do, ads tell them what to do. On the other hand, people have some agency. It is a balance. It's not sort of we're just sitting there inert beings. We do have a capacity to do what we want to do, but it's not 100% one way or 100% the other way. It's this balance in the middle. It's getting the right level or optimal level of legislation and regulation, which in a sense, I guess, does the most for the most people. But, to think that we don't need any legislation in the area of fast food advertising, for example, is silly, because, it's not a level playing field. Ask 90% of mothers, they want actually something done about it because their kids are so bombarded. And we, I think, in Australia, it's first, second or third on the podium for the most junk food advertising.
But, Richard, doesn't it then, aren't we coming down to a fairly kind of negative perception of our own ability to make decisions for ourselves? It's a pretty low view of us collectively if we are so incapable of resisting advertising, for example.
Yeah, look, again, ads wouldn't work on anyone in here, but there's a reason that companies spend in Australia around $15 billion a year on advertising. And by the way, the most marketed to profession in Australia is doctors. And what the thing is with the brain, there's what we think we know and what we know. And what the advertisers know is that advertising is most successful on people that don't think advertising works. Truly, because if you don't think it works, you've got no barriers. And doctors, of course, amongst the most intelligent people in the country, know that all those ads and all those conferences and all those free things on their desk have absolutely no impact on them whatsoever. And those idiots in the drug companies, those idiots wasting billions of dollars a year on things that don't work. That is advertising to doctors. So, look, I think those idiots in the drug companies. I think we have self-restraint, and that's up to ourselves, and regulation is collective restraint, where we say, I don't want to take responsibility for this myself. And for me, you need regulation when you want collective restraint. And the problem is, of course, if everyone else has taken the smart drugs, do I want to be the stupid one? So I need to restrain you as much as I need to restrain myself. Otherwise, and look, I think the obvious analogy is in sport. The Olympics are going on at the moment. There are people who dedicate every waking minute of their life, which might be 24 hours a day soon, to training for an activity. Their life revolves around it, their relationship revolves around it, their health revolves around it, everything they do revolves around it. And we say to those people, but don't take a pill, don't take a performance-enhancing drug, that would help. You'd do better.
You're a cheat.
You'd be a cheat.
Yes.
Like this whole people, they've dedicated their life to doing as well as they can at this one thing. And there are pills that would help them do it much better. And we call them cheats if they do it. And that's because if one person took that pill, everyone would have to take that pill. And we don't know what to do about it.
Sounds like you're going to come down against my human right to have brain enhancement cosmetic pharmacology. I think we should invite some questions from the floor. And please keep your question brief because we don't have a lot of time.
Thank you. Hello.
Yep.
My name is Ken Parker. I'd just like to ask Dr. Dennis and Professor Moody, have they considered what they've said in relation to evolutionary biology? Human beings have a very good fight or flight response, but we've never been good at long-term planning. We don't understand intrinsically or intuitively risks and statistics. So what we've done is we've supported cars and done things which give us immediate gratification, but we haven't really in the past supported the things that you've talked about that could be better for us in the longer term. Not because we're necessarily stupid, but because we're just built that way to some extent. So to help redress the balance, perhaps we need to have the evidence made very clear and people educated to really see economically and otherwise how much benefit these things that we've been talking about would be, and then perhaps we might vote for sustainable transport, for example, instead of the traditional voting for more freeways and even just latterly for a little bit of increase to address public transport.
Okay, can I stop you there? Yeah, so the question is one of evolutionary biology. We're simply not wired to think long-term. We think in terms of immediate threats rather than long-term threats, and can we overcome that with education or perhaps with a pill?
Well, I mean, the economists will tell you all about the sort of short-term preferences versus long-term, and I agree. I mean, it's like hospital. I work in the area of prevention, and one of our problems is that there is no waiting list for prevention. You know, no one's saying, "My God, you better prevent me getting sick in 30 years, otherwise I'll vote you out." You know, we want the ambulance and we want the hospital bed tomorrow. So, I mean, there are some innate things there about what we're trying to do that are very difficult. That's why it requires, real community discussion and debate. Rather than education, it actually requires community discussion and a sense of building of, well, what are the most sensible ways for doing it? I mean, one of the reasons why we do eventually change our transportation routes is because, or ways of doing it, is because congestion, we get sick of congestion. So we actually really do get sick of sitting in the traffic for long enough, and, it becomes in some ways self-regulating, but that takes a lot longer than some other pathways.
Yeah, I always think all those car drivers who honk at me when I'm riding my bicycle, they should be thanking me, because if I was another car on the road, I'd be making them even slower. Richard, did you?
Look, just very quickly, I think that, I guess the point I was trying to make is humans are great at ignoring evidence they feel like ignoring, and we're great at obsessing about other bits of evidence that we're determined to obsess about. And I think for me, both as an economist but as a citizen, for me the interesting questions are, why do we overemphasise some bits of data and evidence and completely dismiss other bits? And I guess I usually come down to habit and what everyone else seems to be doing.
And you're going to blame the media?
And fashion,
normally we
no, absolutely. Yeah. Fashion, media, the culture within which we're making the decision. And that's why in Australia we have entirely different attitudes to gun ownership than Americans. I don't think that's about evolutionary biology. I think it's about what our friends are doing. So I think that if we want to influence individual decision-making and collective decision-making, I think the problem with always saying if we give individuals the right information, they'll make the right decision, we often leave out the most important bit. What are all the cool kids doing?
Okay, another question. We have one there. Yep.
My question is about Rob's response to that question, in that the way to address these problems is through community discussion, because much of what we've talked about tonight brings back to the fact that the solutions to all of the challenges that we face are very simple and very common sense, and they involve questioning what's actually very important in our lives, and spending all day at work and never seeing our kids and all night watching television is really, really nonsensical. And so the way to address that, and the catalyst to change, is always just to bring people together and to have them discussing the issues. And ultimately, when people are drawn together, they come up with really common sense ideas that aren't influenced by all of these large corporations that tell us the way to live. So I'm wondering how your views and a practical solution that we can all take from this with regards to how we would facilitate those sorts of community discussions, if they're the way forward.
Okay, so the question is the point is that often when we discuss these issues, as we are this evening, the answers appear to be fairly simple. They appear to be going back to what's important in our lives, things like spending time with our families, with our friends, rather than just watching TV or whatever. And that if we talk about these things together, we can overcome the power of advertisers and so on. But how do you facilitate that kind of...
Perhaps I presented it just a little too simply. but I mean, because today I've been in all day in meetings about thrashing out how do we value Australia's children much more. I mean, all the indicators put Australia very much, right down about 18th in terms of in the OECD, right down the bottom in terms of our indicators of child health and adolescent well-being. We really do very poorly, particularly compared to Northern Europe and Scandinavia. And the question is, well, how do we generate that discussion in Australia about valuing our children? And that is really difficult, but we will need some enlightened leadership. Now, some of the leadership comes from politicians, some of it comes from sort of academia and from the corporate sector. We need a sufficient level of unity to get the resources to enable a significant community discussion and probably, equally marketing around those sorts of, and almost social marketing to happen before we can change the dynamic in Australia. If we really do want to change social norms and cultural norms, it's a major shift. It's shifted, I think, for the worse over the last 20 years, and it won't just happen with community groups. That is absolutely needed, but we need some enlightened leadership as well.
Look, I think, unfortunately, the thing that gets left out most is what are the barriers to change? Like, if we all here agree tonight, well, let's ban junk food advertising, or let's, any government that spends more on roads than cycleways isn't really interested in changing the balance. Let's come up with some simple solutions. There are people out there, again, they're always out there, who like things just the way they are. And the easy way to keep things just the way they are, like say we want to ban junk food advertising, well, I'll just put my lobbyist hat on and say, well, Richard, that's patronising to suggest that we need to ban junk food advertising, because I've got more faith in the intelligence of the Australian public than you do. In fact, I think that Australian parents, particularly mothers, are more than capable of making these decisions for themselves. And frankly, Richard, it's insulting of you.
You're a nanny, Richard.
For you and your nanny state interventionist, it's an insult to the intellect of the average Australian parent that you think we have to step in and help. And so my point is, even when we know what we want to do, my advice to anyone who's interested in change is never take your eye off the people trying to stop you. All right? Because what they'll usually do is agree with you all the way, as long as, privately they're getting their way. So, win-win, get over it. Win-lose.
One final question. I think we had a question down the front here before, did we? Yes? One final question down the front. Yeah.
My question is for Rob Moody, and it's regarding your comments about a survey. 20 years ago, I wasn't as well off financially as I am now, and my life was a lot less complicated, and now I have a lot more responsibilities, and things are a bit harder to manage. But isn't that just a function of ageing?
So the question is in relation to Rob Moody's surveys, that, we know where surveys show that we believe ourselves to be much better off economically, but emotionally poorer. And whether or not that's just a function of ageing, that as we get older our lives get more complicated. We may not be as rich, but we have more. I mean, I can remember being very happy at the age of 20. Not that I'm unhappy now. But
yeah, no, that's when the mind-altering drugs were really kicking in. When we're but
there's also nostalgia. That has
well, exactly. Nostalgia's not as good as it used to be. That's right. No, but coming back to your point, I mean, this is what people have said, and I mean, it's across a population which is gone from 10 to 30 and 20 to 40, and so it's not just older people who are answering the question. It also, I mean, if you look at Richard Eckersley's work out of Australia 21, then they've said, well, you get to a certain level of material well-being, and it does really make you happier by virtue if you go from poor to reasonably well off.
It's hard to be happy if you haven't got enough to eat.
Well, that's right. But above that, above a certain threshold, it doesn't seem to add anything to our happiness. And I'm not surprised, because it doesn't actually, continually going to buy things doesn't necessarily, make us any happy. Because, I think the time we spend doing that, we're not actually investing in how to develop our emotions. The question is, how do we make our spirits better? How do we make our emotions better? It takes time. I don't think there's a pill, frankly. There may be, but it's hard work. And coming back to Richard's point about we don't necessarily want to do hard work in the short term.
Look, I'm going to draw things to a close because we're running out of time. I would like to thank the City of Melbourne, which organises the Melbourne Conversations events, also Future Leaders, the collaborator on this particular program, and the Sustainable Living Festival and Federation Square Management for making the venue available. I'd remind you that there are surveys on the back of your program form there, which you can fill in to give the organisers your feedback, tell them what you thought, also add your name and email address so you can get invitations to future events. Speaking of future events, there's an upcoming Melbourne Conversation event being held at a different venue. Note the venue will be in the Melbourne Recital Centre next to the ABC on the corner of Southbank Boulevard and Sturt Street on Tuesday the 9th of March, and it will be earlier than usual at 5 o'clock, but very interesting speakers, including the Nobel Prize winner Professor Muhammad Yunus, the founder of the Grameen Bank, and Tim Costello. So that's the 9th of March, if you want to note that down. Finally, please join me in thanking our performers, Anne Cunningham and Astrid Connolly, and our three speakers, Rob Moody, Richard Dennis and Olivia Carter. Thank you.